So just a minute about coronavirus. Unfortunately, this is almost certainly coming. I know they keep saying they're trying to hold it off. And the only real hope from the beginning was that they could hold it off long enough to get a vaccine or something like that. But it's coming, and it's not far off from us now. There is no coronavirus in our community that we're aware of at this time. We've had a couple people present as possibles. The tests have been negative so far, so there is none here. A couple of important things about the coronavirus. One is it is definitely more serious than the flu virus, but it's nothing to panic about. The case, what's called the case fatality rate, appears to be about 2%, but it's probably lower than that. One of the reasons it's spreading, most likely, and they're not like in Italy, they said, well, where did this come from and why is it spreading? It's because there's a lot of people who have it, and they have such mild disease, they don't even know they have it. They're telling people, if you get flu-like symptoms or you get a fever, you should present and be tested. But there's a whole lot of people who may have a bit of a sniffle and not much else. Same thing as the flu. You can get the flu and be really sick with it. You can get the flu and hardly know you have it. But if you hardly know you have it and you're out in the community, you're spreading it around. And that's probably what's happening with the coronavirus. So there's probably a whole lot more people out there who have it that have such mild disease, we don't even know they have it. So when you look at what's called case fatality rates, which is how many people die from the disease per 100 people who get it, they're saying it's about 2 per 100 from the 2 to 3 per 100 from the numbers, but there's probably twice as many people out there at least who have the disease who we're not seeing. So the case fatality rate is probably lower. That being said, the influenza case fatality rate is about 0.1%, so it is still significantly worse than the coronavirus. The bad news, especially for our congregation, is the people that really strikes and makes sick are especially our older population and people that are immunosuppressed. People who have high blood pressure or something like that, you're at no higher risk than anybody else. Young, healthy people, the risk is very low of getting any serious problems. But for people who are older, because our immune system declines as we get older, that's the people that are at risk, especially of getting severe disease. And people who are immunosuppressed, people who are on chemotherapy, people who are on various drugs that suppress their immune system are at higher risk. But the fact is, for most young people, you're going to get the flu, like flu-like symptoms and feel unwell, but most people are going to recover from it. They had one lady who was critical, who was 80 years old in Vancouver, I think, who was critical, and she's recovering now. So there's been no deaths in Canada as yet from this disease. But as I said, unfortunately, it's probably going to come. The infection is spread through contact, okay? Droplet, people coughing on you, coughing at you, sneezing at you, and things like that. They say if you maintain a different distance of 6 feet, you're kind of protected from that. The other concern is, and the main reason it's spread isn't because people have coughed on you, it's because I cough, I touch the table, and then you come along and touch the table, or you touch that can of soup they touched in the store or something like that, and then you touch your mouth, and now you have the virus. So that's the key, is hand washing is critical, is the number one thing, is wash your hands. Anytime you go anywhere, wash your hands, okay, or use hand sanitizer. So that's really the key to preventing the spread, preventing you from getting it. For people that are at high risk, for people that are on immunosuppressive drugs or people that are older, when it comes, and as I said, it's probably going to come to our community. Once it's in our community, my recommendation would be stay home. Don't go out any more than you have to. If you go out, if you go to the store or something like that, don't touch your face, keep your hands down, and wash your hands well when you get home. Okay, that's going to be really the key, is just try and not get exposed. No handshaking. In our society, it's automatic. Reach out and shake hands with people. And I really advise people to not do that, because that's the other way it's spread. Any questions about coronavirus?
Does the flu vaccine that lots of people get have any effect on this?
Completely different virus. Vaccines in general are good for, if you get the chickenpox vaccine, it prevents shingles and chickenpox. doesn't prevent anything else. Okay, you get the flu vaccine, it prevents the flus that it's designed for. And the problem with the flu vaccine is they're trying to predict from, like this summer, they'll try and predict what's coming around next year by what's in the south, by what's in Argentina and New Zealand and Australia and stuff, and then make a vaccine for it that we get next year. And if some other flu comes along that's not in the vaccine, then you get the flu. And that's why the vaccine is not 100%.
Just, can you reaffirm as to when we should go to the hospital to get checked out for this? Like, what symptoms? Because everything else we can stay home, but common sense, of course, you have a super high fever, but is there anything else that
We're going to talk about that this week amongst the physicians in our community. The recommendation is probably going to be stay home and call your doctor. Okay, but we're not sure because we would, and we'll try and, we hope to be able to get somebody to come out and test you. Okay, because you come to the hospital, you're exposing other sick people and stuff at the hospital. We're not, that decision hasn't been made yet. Right now it is, come to your doctor, but tell them when you get to the desk, tell them you've got flu-like symptoms and you'll be isolated right away. So you're not sitting in the waiting room coughing over everybody. Yeah. But again, that's not, right now, it's not in our community yet. Okay, once it's reported in our community, then we're going to have protocols to deal with that. Yeah.
Do you have a quick way to test in our community?
Yes, we have swabs. The swabs are, the turnaround time for the swabs is supposed to be 6 hours, but by the time we get it to the center to get tested, it's usually going to be probably a day, 24 hours at least to get the test results back. Okay.
I haven't had the pneumonia shot. Is there any purpose in getting that shot? Would that help in countering, or, in the fight against coronavirus that comes?
Coronavirus causes pneumonia is its primary concern, and it causes what's called adult respiratory distress syndrome, which is patches of consolidation in your lungs. That's caused by the virus. But any virus like the flu and stuff like that, you can get secondary pneumonia. I compared, if you get a cut on your arm, you don't need antibiotics or anything for that cut. But some cuts will become infected. We don't know why for sure. Some get infected and others don't. And once it's infected, now you need antibiotics to clear that. When you get a virus in your chest, antibiotics are useless for treating the virus. But the virus opens you up potentially to other bacterial infections. And if you get a secondary bacterial infection, a bacterial pneumonia, then that can be treated with antibiotics. And bacterial pneumonia can be prevented to some degree by the pneumonia vaccine. So for people over 65, the pneumonia vaccine, if you've never had it, it's a once-in-a-lifetime shot. It is available at Public Health for free. Anybody over 65 or immunocompromised people or people who've had their spleen removed, certain conditions, people qualify for that. And it's free at the Public Health. But it won't do anything, unfortunately, for the viral pneumonia caused by coronavirus. But if you get a secondary bacterial pneumonia, it will help you. Okay. If people have questions, I'm always happy to answer questions after. Okay, call to worship. On this second Sunday of Lent, in this time of uncertainty in our lives and our world,
we come seeking God,
quieting our minds, opening our hearts, and waiting for the divine mystery to make itself known.
We come to worship God.